So after you apply your adhesive, what you check in your adhesive is how your adhesive can penetrate water. For example, you can do this testing in your clinic, whatever bonding you have. Take 2 drops of water on the paper pad and put 1 drop of adhesive on the water. You see with single bond, the water is still in the center. Can you see that? The adhesive is going outside. That means this is not penetrating the water. What is dentine? Dentine is all moisture. You need an adhesive which penetrates water. If you see prime and bond from dense ply, you see how the effervescence is. Can you see? It's just penetrating the water because it has that kind of chemistry. It is both hydrophilic and hydrophobic. So please check if your adhesive does not penetrate water. See, now when I'm applying my adhesive, nothing is going on the center. Everything is going in the periphery. This is dangerous. Your restorations might not hold. Okay, please do these testings for yourself. Of course, do some research as well. But whereas if I am applying my prime and bond universal, you see, I get a very uniform layer on my dentinal surface. Let's look at one more exercise. For example, if you want to see how much of penetration your adhesive can go into dentine, what I do is take 2 drops of adhesive. You have cotton rolls, correct? Cut 2 millimeter of cotton roll, place it on the adhesive like that. So now this cotton roll is like collagen fiber. It's like collagen fiber of dentine. So you see how much of cotton roll gets wet. How much is wet? In 20 seconds. You see some adhesives will wet only 25%. Some adhesive will wet 50%. But I need more than 50%. That is my best adhesive to use for my patients. Okay? So you have clear fill universal from Curare. You have prime and bond universal from dense ply. And you see the moment I place it on prime and bond universal, you see the kind of wetting this adhesive creates, and it penetrates the cotton. So you can do these testings by yourself and see what's happening, okay? Because we as clinicians, we cannot go into the lab and do all these testings. These are the tests which will tell you, okay, this is how this material is working, right? You see the kind of wetting, this is almost 100%. So you could do that. And whenever you buy a bottle of adhesive, anybody using universal adhesive, single bottle, please remember 2 important things. Chemistry. What do you mean by chemistry? Every bottle has 2 important things: resin, solvent. Okay, these are 2 important things: resin, solvent. Both of them hate each other. They don't like each other. But unfortunately, both of them are in the same bottle.
Same bottle.
You see how this is the irony. So now, when I keep this bottle like this for 1 day, I'm not using it. I'm doing some endo or I'm doing some other things. Since they don't like each other, the resin will come down, solvent will go up because they hate each other. This is called phase separation. Phase separation. They separate from their phase. So what is important, whenever you use the recent adhesives, universal, you have to do this.
Shake before use.
Because now you are forcing the resin and the solvent to meet each other. Because when I am applying my adhesive on the surface of dentine, what should go inside? Resin. Who should push the resin? Solvent. If solvents are not there, resin cannot go inside on its own. It needs a vehicle. Somebody has to push the resin. So the solvent will push and the resin will go in. So after you apply for 20 seconds, then what is the most important step? Air blow. Why am I doing air blowing? To remove all the solvent, because now solvent has no business to stay there. If solvent stays there and you put your composite, your patient will come back with restoration full out. In a Ziploc cover, he'll come next day, doctor, this filling came out. That is because of the inhibition. The solvent inhibited the polymerization of composite. Please, any step you do, air blow. I will show you in the hands-on how you do air blowing. So when you air blow, suppose you are air blowing the anterior tooth, you don't come head on. You do it from the side. You have your 3-way syringe, correct? Check first on the glove finger. There should be no oil, no moisture, no contamination. It should be dry, compressed air. Is it very clear?
Yes.
Try compressed air. You don't push the 3-way syringe fully, because if you push fully, it is 40 psi, lot of pressure. You need only 10 psi. So push your 3-way syringe only 1/4, and then just air blow. When you air blow, you see with your eyes, the fluid will move like this. Something will move. That's your solvent. For 5 to 10 seconds, the solvent will move, and the fluid movement stops. What does this indicate? You have evaporated all the solvent. Now you are ready to light cure. Now you will never fail. Is it very clear? These are basic steps in adhesive dentistry. Don't ignore them, and then don't blame the material. You have to follow them very strictly. Okay? Whenever you buy a bottle, every clinician thinks, oh, this is very expensive. I paid 5,000 bucks. Oh, no, it's very expensive. But you know, you can do 300 applications. Per application is costing you only 25 bucks. It's not expensive.
Yeah.
So what many people do when they buy new, correct? They open this bottle, okay, new, they bought new, they paid just now. First 2 cases they will only use here, from here. Whatever they will see, liquid, fluid. This is ridiculous. You can't do that. Because whatever you see here is only resin, there is no solvent. Your restorations will fail.
Not push the micro.
Absolutely. So you have to shake, dispense 2 drops on the dish, then use it judiciously. Don't be stingy with adhesive. And please, you have to handle this. Don't tell your assistant, because the moment I dispense, I have to close it immediately, because I don't want my solvent to evaporate. Otherwise my bonding is of no use. So I see many people, they open. This is how they use. They use it like this. They get the brush in the clinic also like this. Half of the drop is dropping, half on the brush. And now what is happening is, this bottle is open for so long. You are allowing all the solvent to evaporate. Don't do that. Be quick. Less than 5 seconds, dispense 2 drops, immediately close it. Tightly. Very, very important. And please store them really well. It is written very clearly on the bottle. 2 to 24 degrees. 2 to 24. That means whenever you go back home from the clinic, please put it in the fridge. Whenever you come in the morning, get it out from the fridge half an hour before the case. Half an hour before the case. Because this bottle has to come back to room temperature. If you don't do all these storage things, your chemistry will change. Then don't blame the manufacturer, because they have given you all the instructions. It is our fault, we don't follow them. Is it very clear? So these are some basic things with adhesives. Any questions? This is exactly how you air blow. You see? Can you see something moving? See there, see there. That's your solvent. Once the movement stops, you get light cure. Okay? Finally, one more important thing before we finish the adhesive is the thickness. How many of you have looked at this parameter? What do you mean by film thickness of adhesive? Whenever I apply 2 coats of adhesive, 20 seconds, and I light cure after air blowing, I get a thickness, I get a film of my adhesive, correct?
Yes.
How much it should be in thickness, ideally? Less than 10 microns. If it is more than 10 microns, that means your adhesive thickness is too high. It's too thick. It can fail. Your restorations can fail. Your interface is too thick, so it's not good. So please buy adhesives which have low film thickness. Okay, see, these are too much. This is more than 18 microns. 18, 17, 16, 15. I need less than 10. Okay, you can read this paper, research paper by Rees et al. He has checked all the possible adhesives available in the market. And what he found was, there is a lot of variation. Some adhesives are giving you too much of a thick layer. Some adhesives are giving you ideal thickness. Okay. Now, why this is important is, you can do this testing. Do your restoration. Take an X-ray. In X-ray, if you see a radiolucent line below your restoration, a very thin, faint line, which is very uniform, that is not secondary caries. That is your adhesive. See this. Take an X-ray after you do tomorrow. See, if you are getting too thick, that's not the right adhesive you use. Especially now because we are doing a lot of indirects. I will also show you indirect restorations like overlays, onlays. So when I am doing an onlay or an overlay, I have only 30 microns of space, correct? My technician will give me only 30 microns for cement and adhesive. That is 25 and 5 or 22 and 8. If my adhesive is giving me 18, cement is 25, that means 43 microns. What will happen? I will not get a good fit. After I bond, my patient will say, doctor, little high point is there. But it was not there when I did my trial. Are you understanding? So please use adhesives with low film thickness. Do some industry update, be updated. So this is what I meant. Adhesive layer is, this is the thickness. I'm not looking at this or I'm not looking at this. Okay? If you have to be a successful practitioner, please remember, it's not only about the skill. It's about the way you talk to the patient, the way you approach. In my experience, tongue is 50% and 50% is your skill. Okay? Because please remember, when the patient is coming on the dental chair, anything related to the mouth is directly related to the mind. It's all psychology. So you need to work on their psyche. You need to work on how you can convince them, how to talk to them. Even if it fails, they will not tell you anything. They'll say, okay doctor, I trust you, kindly go ahead. So it's all about talking. That's why I said on the start, keep a rapport with your patient. Don't think the patient has come to you, you did a restoration, you charged him, and now you don't have relationship with that patient. No, that's wrong. You should call them every 3 months, 6 months. Tell your front office to call them. Ask them how they are doing, how are things going, can we have you for a checkup, for a follow-up. So in this way, the patient thinks, oh wow, he just did one filling and he's calling me, he takes care of me so much. And in the same time, what happens is, it also tells you whether your restoration, how is it doing in the mouth. So you know exactly whether your technique is working or not. Okay?
How did you fall in love with composite?
That's a big story. Okay. So when I completed my masters in conservative dentistry and endodontics in 2004, so I came back from the university to the place where I live, that's Bangalore. And as everybody, after they pass out, they look for a job. That's exactly what I did. So I gave my resume to different universities because I wanted to work as a faculty. And then I was lucky, within a month I got a job. And then when I was working in the university, there was nothing happening apart from, in our department there was only access opening. There was just opening access. And nobody was actually understanding what is aesthetic dentistry is all about. For them, it was all about filling. If any patient comes, they're only looking at filling. But for me, I had in the mind that when we don't respect nature, if you're going against nature, we are actually not restoring, we are just filling. So there's a difference between filling and restoration.
In Bangladesh, they got pudding.
Pudding, okay. So there are 90% of them who always do filling. They're very quick, they don't respect about substrate,
Just
nature,
fill the
nothing. But what you guys have to do is, you have to change your mindset. When you're doing anything, it's all about restoring. When we talk about restoration, it's all about mimicking nature.
Mimicking, yeah.
So that's when I felt I'm missing something. I have to go, I have to learn this, and that's why I went to NYU, to Buffalo. And then I was there for 6 months. And that's when my approach, my perspective changed towards aesthetic dentistry. And that's how my journey started from 2004 till 2022, and there's no stopping. Every year I learn, every month I teach. Even in my center where I do my courses, I teach, I mentor people one-on-one. It's not a big batch, it's just 1 or 2, and I do a lot of mentoring. So we try out different techniques. So as I said, it's all about passion, it's all about the right attitude, it's all about the patience. And trust me, everybody can do what most of the good clinicians are doing. It's not only that only he can do, I cannot do. No. He's doing it because he's got the right approach, right attitude. And I think we need to inculcate those kind of approaches. So that's how it helps.